There's a lot of fear about a fourth COVID surge because cases are on the rise around the country, especially among younger people.
Yeah, the numbers are rising nationally as we're opening locally more and more kids are coming back to the classroom, too, for in-person learning.
Which seems dangerous or counterintuitive.
Yeah, but let's find out more about this. Joining us now to talk about this is UC Berkeley infectious disease expert, Dr. John Swartzberg. Dr. Swartzberg, thank you so much for joining us once again.
You're welcome. Good morning.
Good morning. Is it wise to reopen schools? I know the Bay Area seems to be in a different boat than nationwide, but could that be like our boat soon? Do we need to be careful?
Oh, we absolutely need to be careful. We have to learn from our previous mistakes that we've made. That is, we tend to open up too soon, and we wind up with another surge. And it looks like that's the direction we're heading right now. Fortunately, the Bay Area consistently throughout this pandemic has done much better than the rest of the country. But we can't depend upon that going forward.
Is this because we're seeing states that had previously opened up more broadly than we did starting to see these upticks in numbers, and we're seeing that as a harbinger of what may come to California?
We're seeing that as a harbinger of things to come. We're also seeing, look at Western Europe. They're locking down with the exception of Britain. India is having a terrible time. Brazil is now the leading country in the world in terms of the number of cases per day. So what's happening around the rest of the world ultimately always comes here. And we are seeing it here. We've seen in the last 2 weeks plus, a rise about 15% in the number of cases. So we had this roughly 9 weeks of a wonderful decline of cases here in the United States and other countries. Then it plateaued, and now we're seeing it rise again.
Wait, but Doc, or are we seeing the result of the fact that we're only letting the older folks get vaccinated? So we're all getting ourselves covered. The kids are running around out there. We didn't bother to give them the vaccine. They still can't get it.
The major driver for this pandemic in terms of the number of cases are people roughly in their 20s and 30s and mid-40s. We've seen that consistently. And that's still a population in the United States that doesn't have the same percentage of people vaccinated as older groups. So I wouldn't blame this on the kids right now. I would blame this on the 20s, 30s, and mid-40s.
Well, but they can't get vaccinated either. I mean, you don't forget, we were doing a oldest first system. And I think there's only like one country didn't do it that way. They said, we're going to vaccinate the young people who are out and about working, the 30s, 40s, 50s. We went about it the other way. So I wonder if that was a mistake. I mean, like you said, they're the most active. So don't we need to get them vaccinated?
We need to get everybody vaccinated. You're absolutely right. You know, the strategy of picking older people first was that that's where roughly 80% of the deaths occurred. So if the goal was and is to prevent deaths, that's where you go for that population. If the goal is to slow up this pandemic and stop it fairly quickly, then the goal would be to vaccinate younger people, but you'd have so many more deaths. So, you know, there's no easy way out of this in terms of a solution. The major solution, frankly, is to get this vaccine into everybody's arms as quickly as possible.
Is it also possible that we're seeing the effects of all the travel that we saw during spring break, or has not enough time gone by yet for those numbers to come in?
In the past, we've seen when there are indiscretions like spring break, it takes usually about a month to see an uptick in cases. You know, what happened in Florida, for example, which was just an abomination, the people leave Florida and they fly back to their homes all around the United States, seeding the virus in those places. You'll see an uptick probably next week or the week after that from that. But it's not going to be as dramatic in Florida because a lot of the people were visiting Florida.
Oh, but it's so creepy the way you use that word, seeding. You know what I mean? Invisibly seeding and the new variant, right, which is more contagious. And then you've got us still struggling with the supply situation. So how are we setting the Bay Area for that? Because we're all supposed to be opening up to the younger people, right?
16 and over.
Will we have enough?
I think so. You know, the stars have to be aligned, but the commitments by the pharmaceutical companies are sufficient to really fill the pipeline with the amount of vaccine we need by the middle of April. Things could go wrong. There could be a production problem, for example, but my fingers are crossed that things will go as planned. And I think there's a good chance they will.
How come there's such a drastic difference between people who get the shot and they're like, oh, I was fine or I had a headache, and then I talked to a guy, perfect. He was like a distance runner, 50 years old or less, and he 2 days thought he was going to die. I mean, he's fine now, and he says, oh, I would take that any day over COVID, right? But he definitely, like, was out bad.
Yeah, you know, it's impossible to predict who's going to have a bad reaction. We have some data to suggest that actually suggests pretty strongly that women have more reactions than men, higher fevers, for example, that older people tend to get less of a reaction than younger people. But, you know, after my second shot, I felt lousy the next day and that next night. And my wife felt lousy for about a day and a half. And we're certainly in the older group. So there's really no way to predict. One thing that I've had a lot of questions about in regards to that is that a lot of people don't get much of a reaction at all. Some people really don't get any reaction, and they're worried that they're not getting a good immune response. We know that they do get a good immune response. They should just consider themselves lucky.
Yeah, but let's not forget that the vaccine hadn't killed anybody so far, and COVID sure has.
Over
so
500,000.
Yeah.
Right.
Wow.
That's well put. That's the bottom line, isn't it?
And then one quick before we go, I'm just curious, as an infectious disease expert, I see this thing on the global perspective, and you have countries that are struggling, you have numbers that are going up here and there. The vaccine is getting out, but I guess, is it really, it's a race against time, isn't it? Because we want to get to herd immunity before there's a variant out there that can be resistant to this vaccine that we've spent so much time developing.
Absolutely. We want to get as many people vaccinated as possible so we save lives, so people don't get real sick, so people don't get long COVID. But we also need to get to this community immunity, some people call herd immunity, as quickly as possible so we don't generate new variants. Every vaccinated person is no longer a variant factory, and that's where we've got to get to.
Okay, thanks a lot. We appreciate you joining us this morning.
You're welcome.
And we'll be right back.